Wonderful. Well, I'm joined by two wonderful colleagues, Trisha San Diego and Maggie Flowers, who is the SHIP program manager at the Administration for Community Living. Maggie will be on a little bit later to really talk about the resources available to you via the SHIPs and a number of different resources that the ACL has for you. Before I turn over to Trisha from ARP, just a few quick moments of housekeeping. One, we will have time for question and answer, so be sure to use that Q&A button. It really helps us track the questions and kind of make sure that we get to each one of them. And two, this is being recorded. So, if you need to reference this later at some other point, just know that you will have access to the recording. We'll share it out later this week via whatever email that you use to register. And so without further ado, it's my pleasure to hand it over to Trisha San Diego, Director of Programs at ARP, to really guide us through today's session. Trisha, over to you.
Great. Thank you so much, Colin. Thank you, Maggie, for being here and for all of you all who are attending today. As Colin mentioned, I'm Trisha San Diego. I come from AARP, Director of Programs there. I do a lot of education around caregiving and Medicare information. And I'm so happy that you're all here to join us today. The session is on Medicare 101 for you, your business, and your eligible employees. So hopefully you'll get sort of the nuts and bolts of Medicare today. This is the agenda. We're going to cover the basics and try to really boil it down so that it's in sort of a digestible, easy to understand manner. Then we're going to teach you how you might be able to educate your employees on Medicare. And then we're also going to provide some resources and tools that you can go to for more help. Next slide. So some common questions that I know we have heard from Medicare eligible people are things like, what is Medicare? What is covered? When should I enroll? What happens if I don't enroll? How will Medicare work with my existing health care? And these are all really great, valid questions that you may get from your employees if you are a small business owner, or from your own situation that you're thinking about, or family members. If you're a caregiver of someone who's trying to navigate Medicare, you may be experiencing these same type of questions. I myself am a caregiver. I'm trying to navigate a lot of these things for my parents who have Medicare. And even sort of being in the field, like something always comes up and you do have to kind of get to the bottom of it. And it's a lot to sort of disentangle at times. And so it's good to kind of know the basics at least so that you have a solid foundation. And then as more things kind of come your way, or as certain time periods come up where you're going to be more engaged and involved in your Medicare coverage, or your employees are going to be making critical decisions, it's really good to know where you can turn to. So next slide, sorry. Today, we want to outline sort of what your role can be as a business owner when it comes to Medicare education. I'm sure you have a lot of other sort of issues and topics that are of concern to you as a business owner, as well as to your employees. Maybe Medicare is something on the list, or healthcare coverage, maybe not. But this is one way where we're outlining how you can be involved and sort of where those maybe guardrails are and boundaries are when it comes to this type of education. One thing that you can do is provide Medicare eligible employees with educational materials and about Medicare. This can be sort of resources, websites, links, phone numbers that you can turn to. We have tools that are really helpful for people in navigating Medicare. You can also connect employees with unbiased sources of information. We have Maggie here today. I think the SHIPs are one that you'll learn more about, and that's a really great place to refer people to if they have specific questions about their own Medicare. And then you can also help Medicare eligible employees avoid enrollment penalties. And the way to do that is to serve as sort of a reminder function when it comes to certain timeframes for them to enroll. Penalties do come into the picture when people who are eligible for Medicare don't enroll when they're supposed to, or they delay without having sort of the eligibility to be part of like a valid special enrollment period. And so these are important time frames that people need to remember when it comes to enrollment. And sometimes they may not be aware of it. And maybe that could be a function for you is simply in the reminding, not necessarily being a Medicare subject matter expert yourself, not advising people on what they should buy or what they shouldn't buy, or how they should get their Medicare coverage. It's very much an individual decision, but you want to point them to the resources where they can learn more about Medicare so that they can make the best informed decision for themselves. Or if you're doing this for yourself, so that you can have all the information that you need to make the best informed decision for you. Next slide. Let's start from the very basics, which is what is Medicare? Medicare is a federal health insurance program for people who are age 65 and over. It's also for some people younger than 65 with certain disabilities, and it's for people with permanent disabilities such as end-stage renal disease and people with ALS, which is also known as Lou Gehrig's disease. Next slide. We'll go for some basic terminology that's sort of insurance terminology that you may already be familiar with, but it also applies to Medicare. But we'll kind of briefly go over the definitions of each one just so that you know the different types of payments essentially that need to be made or costs associated with Medicare. Like most Medicare, Medicare does not cover all your healthcare costs. People are responsible for paying a portion of costs that are not covered, such as your monthly premiums, deductibles, co-insurances, or co-payments. And we'll take a minute to briefly define them. So a premium is the monthly amount an individual would pay to Medicare or a private insurance plan for an individual's health care and prescription drug coverage. So you'll normally have a premium for the medical care and a prescription drug premium. A deductible is the amount an individual would owe for all healthcare services that the health plan covers before your health plan begins to pay. The deductible may not apply to health services. So it's the certain minimum amount threshold that you kind of need to pay out of pocket first before the insurance or the Medicare coverage kicks in. Co-insurance is the amount an individual may be required to pay as a share of the cost for services after they pay any deductibles. And co-insurance is usually expressed as a percentage. For example, in general, Medicare will pay on average 80% of something and your out-of-pocket cost is 20%. Co-payment is the fixed amount an individual would pay for a covered healthcare service, usually at the moment of transaction when they receive the service. The amount can vary by the type of covered healthcare service. So this could be a medical visit with the doctor or a specialist. That's a certain copay amount. If it's an ER visit or an urgent care visit, that would be a certain copay amount as well. Next slide. One thing that we get a lot of questions about is sort of what Medicare does not cover. And some of these things are surprising to some people. So it's important to kind of have a general awareness about the things that Medicare does not cover. It does not pay for vision, dental care in most cases, hearing, or long-term care, such as extended stay in a nursing home. Medicare Advantage plans may cover some of these that are listed, but original Medicare does not. We will get into the differences between original Medicare and Medicare Advantage briefly. The fact that Medicare does not cover long-term care services is a surprise to a lot of people. Medicare only helps cover certain services if they are medically necessary, and it does not cover what we call custodial care, which is help with activities of daily living, such as bathing, eating, dressing, and using the toilet. So those are things to keep in mind. Vision, dental, hearing, and long-term care in general is not covered by Medicare. Let's go to the different parts of Medicare. Medicare is a bit of an alphabet soup, and the different parts of Medicare are identified by different letters. And we'll start with Part A. So you'll talk about these different components of Medicare. You'll hear them referred to as parts. So Part A is hospital insurance. It helps cover inpatient hospital care, some home health, hospice, and some skilled nursing facility care. let's go to the costs for Medicare Part A. For Medicare Part A, the costs for, we're already at the end of 2023, so we have the 2024 costs listed here. Typically, those who qualify for Medicare don't pay a premium for Part A because they already sort of prepaid for it through their payroll taxes while working. If you do not have premium-free Part A, you may be able to buy it under certain conditions. So Part A, hospital coverage, and typically no premiums, but if you didn't have a certain number of sort of working periods in your life where you were able to pay through payroll taxes, then you may have to pay a premium for Part A. Part A has coinsurance in addition to a deductible. There is a deductible of $1,632 in 2024 for inpatient costs for each benefit period. The benefit period ends when you haven't gotten any inpatient hospital care for 60 days in a row. If you go into a hospital or a skilled nursing facility after one benefit period has ended, a new benefit period begins. So as you can see, we can kind of quickly get into the weeds with the different coverage sort of rules, but that's just one thing to note when it comes to the Part A deductible. Next slide. So now we're going to talk about medical insurance. This is Part B. Part B plans are typically cover medical coverage, which is going to be a portion of the cost of doctor visits. It's going to be things like outpatient hospital visits, durable medical equipment, also known as DME, things like wheelchairs, walkers, hospital beds, for example. It's going to cover rehabilitation therapy, laboratory tests, x-rays, mental health services, and then some approved preventive services to help maintain your health and detect problems early when they're at a more treatable stage. So these Medicare approved preventive services could be things like screenings. Next slide. Going into the costs for Part B medical coverage, the cost for 2024, the standard premium is going to be $174.70 per month. Those with higher incomes, please note, they're going to have sort of a adjusted amount for their monthly premium. Individuals earning more than $103,000 a year, or couples earning more than $206,000 a year will pay premiums based on their income. So likely to be higher if you make higher income. And that's called the income related adjustment, I believe. The annual deductible for Part B in 2024 is $240, and coinsurance is 20% for most services. Next slide. Okay, now we're going to sort of switch gears and talk about Part C, Medicare Advantage. It's not really a part. It's actually a whole other different pathway on or option on how you can get your Medicare coverage. Original Medicare is comprised of Parts A and B, which we talked about, and sometimes D, and or a supplemental plan if you're interested in that route. That's original Medicare. Medicare Part C is actually a whole other pathway. So I'm pointing to this side of the slide because Medicare Part C is a whole different way of getting your Medicare coverage. It's called Medicare Advantage plans. It's an alternative to original Medicare. And they are plans that are private health plans offered as an alternative. They are provided by Medicare approved private insurance companies. And all Medicare Advantage plans must include Part A and Part B. In most cases, they will also include prescription drug coverage, Part D. So I kind of stepped aside here to talk about Medicare Advantage. It's called Part C. Like I said, it's not really a part to original Medicare. It's an alternative. So how Medicare Advantage works, let's go to the next slide. Medicare Advantage plans are available in most parts of the US, but you must live in the plan service area to receive services. You must choose from the plans available in your area and sign up directly. Medicare Advantage plans pay for the same healthcare services as original Medicare, but they also might pay for additional healthcare services such as vision, hearing, and dental. In most Medicare Advantage plans, you can only go to doctors, specialists, and hospitals on the plan's provider list. Plans may limit coverage or provide no coverage for out-of-network providers. You may also have to follow the insurance company's rules, such as requiring a referral before you see a specialist. So make sure you understand how Medicare Advantage plans work before you join, because there could be some pros and cons for you if this is what you're interested in. And note some of these things to consider, such as, do you live in the plan service area? Are there, different Medicare Advantage plans options for you available in your area? Also, look at that in-network list. Your providers that you already go to may not be part of their network, and then you may not get that coverage, or you may not be able to stay with those same providers. So just some things to kind of note. Next slide. Prescription coverage. So going back to original Medicare, which had Part A, hospital, Part B, medical, as sort of a la carte options. Here is Part D, which I think is easier to remember. D stands for drugs. Part D, prescription drug coverage. It helps cover some of the costs of prescription drugs that an individual picks up at the pharmacy. Part D plans are run by Medicare-approved private insurance companies. To get Medicare prescription drug coverage, you must sort of actively join a plan run by an insurance company approved by Medicare. If an individual is eligible to join, but they do not, there could be a late enrollment penalty. So this is something that you need to really take note of, is that you need to actively enroll in a Medicare Part D prescription drug plan. You need to sort of shop around for the right plan that's for you in order to get this drug coverage. It's provided by standalone Medicare prescription drug plans, and Part D, like I mentioned earlier, is usually included in Medicare Advantage plans, the Part C plans that offer coverage for both prescription drugs and healthcare. So you have original Medicare, Part A, B, D, and then you have Medicare Advantage, Part C. Part C usually includes all of those. And you can, we'll talk a little bit more about that. But let's go over the costs first for Medicare Part D. This is for 2024. The benefits and costs are going to vary widely among plans. There is typically a monthly premium, deductibles, and co-payments associated with Part D, unless you qualify for additional financial assistance paying for these costs. As with Part B, premiums for Part D are higher for individuals earning more than $103,000 a year, or for couples earning more than $206,000 a year. So that's that income related adjustment amount that I mentioned for Part B. You will have, in general, a higher monthly premium than the sort of average premium. For 2024, the standard benefit for Medicare Part D includes a $545 annual deductible. After meeting the deductible, you are responsible for 25% of your covered Part D prescription drug costs until your total spending reaches the initial coverage limit, which we don't have this on the slide, but it's actually $5,030 in 2024. Next slide. Okay, so we went through the individual parts, and now here is sort of an overview of how that looks. There are those two main sort of pathways or options for how you can get Medicare health coverage. First, you have original Medicare, which is the darker, smaller triangle inside. Original Medicare is also sometimes referred to as traditional Medicare. If you have original Medicare, Parts A and B, which is hospital and medical, and you want prescription drug coverage, that's the plus D there, you actually do need to shop around and join a Medicare prescription drug plan. If you don't join a Part D plan initially, and then you don't have any drug coverage, but then you want to join later, you could incur a fee. a penalty. Medicare Advantage is the larger gray triangle. It's also known as Medicare Part C. These Medicare plans are offered by private insurance companies and typically include Parts A, B, and D all under one plan, which is why it's sort of the bigger triangle because it combines it all. So it's like, do you want your Medicare, your original Medicare sort of a la carte, or do you want it sort of all in one stop shop, which is going to be sort of more your Medicare Advantage Part C option? Next slide. Let's talk a little bit more. So Original Medicare is a fee-for-service health plan. Original Medicare consists of both Part A and B and covers many, but not all of your costs. In general, it pays about 80% of your covered medical costs after you pay your Part B deductible. Because Medicare does not cover all your healthcare costs, some people consider buying a Medigap policy. And we'll talk about that a little bit further. You can only get a Medigap policy if you have original Medicare. You cannot purchase a Medigap policy if you go with the Medicare Advantage route. People with original Medicare can go to any doctor, hospital, or other health provider who accepts Medicare, which includes about 95% of physicians. So basically, any doctor that accepts Medicare you will be able to use your original Medicare with them. Now, not all doctors may necessarily be accepting new patients, and so that's something to kind of think about if you're switching providers. But it's good to talk to your doctor and confirm that they accept original Medicare if you are going to be sort of transitioning over to that. If you have original Medicare and you want to get Medicare prescription drug coverage, I think we've mentioned this a couple times, you have to shop around and choose and join a Medicare Part D prescription drug plan. Next slide. Medigap coverage. Medigap coverage is a supplemental insurance policy. So I talked about, sometimes if you want a supplemental plan to help cover those out-of-pocket costs like copays and that kind of thing that you're paying for with original Medicare, you can buy Medigap coverage. And sometimes this is referred to as Medicare supplemental plans. Medigap is a private health insurance that helps pay for healthcare services that original Medicare does not cover, such as deductibles, co-insurances, and co-payments. Medigap is only available to people with original Medicare. It does not work as a supplement to Medicare Advantage plans. In fact, I don't think you're even allowed to purchase a Medigap plan if you have Medicare Advantage. Insurance companies in most states can offer up to 8 standard Medigap plans for new enrollees. Each one offers a different level of benefits to fill in different gaps in financial coverage, and it's going to vary in price. So you want to kind of shop around and see which plan in your state is something that you are interested in getting, and that is for the Medigap plans. All Medigap policies must cover hospital co-insurance for Medicare covered hospital stays, as well as Medicare co-insurance on your doctor's bill and all other Medicare Part B services. Next slide. So, how does a Medigap work? Individuals can purchase a Medigap policy within 6 months of enrolling in Part B. If you forget to enroll during this time period, this 6-month period after you enrolled in Part B, the insurance company may be able to charge you more or may even refuse to cover you. So the 6-month period is really critical when you first enroll in Medicare Part B. You need to decide if you want to purchase a Medigap policy, because if not, you may not be able to purchase one, or you may be charged more. Also important, if you choose Medicare Advantage instead of original Medicare with Medigap, your ability to purchase a Medigap plan in the future may be limited. So let's say you go with the option of Part C and you get a Medigap plan, which we said you're not able to purchase Medicare Advantage plan. We mentioned you cannot purchase a Medigap plan if you go with Medicare Advantage. You are not sort of stuck in Medicare Advantage forever. If you decide in a year you want to change and go to original Medicare, that's an option that you can do during Medicare's annual open enrollment season, you can make those changes. You're not locked in forever into your Medicare option that you choose. But one sort of important note is that if you sort of start with Medicare Advantage, you may be limited in purchasing the Medigap plan if you want to purchase that in the future when you switch back to Medicare, original Medicare. Medigap policies do not cover the cost of prescription drugs. That's a whole other plan. That's Part D. You need to actively shop around and join and purchase a Part D plan. Medigap plans, which you also shop around for and optionally purchase if you want it, those do not cover prescription drug plans. Medigap plans also do not cover additional benefits such as hearing, dental, and vision. I don't want to confuse Medicare Advantage with Medigap. Note that Medicare Advantage Part C, the sort of all-in-one stop shop way of getting your Medicare coverage, sometimes those plans do have those added perks of covering vision, dental, and hearing. You just kind of need to shop around and find the right plan for you if those are things and benefits that you're interested in. Next slide. Let's talk about timing. When do I enroll in Medicare? When should my employees enroll in Medicare? Sometimes Medicare eligible employees will ask their employers, when do I sign up for Medicare? With many different terms and timelines, it can be unclear for people to know when they should or can sign up. If employees do not sign up for Medicare during the appropriate window, they may incur a penalty. So this was one of the roles as a business owner, or that we think that you could play, or an HR professional, is that reminding function, and that would help people. It's not something you're required to do, but I think it would be helpful to help them avoid costs and potential gaps in coverage. These 3 enrollment periods listed here are ones we're going to talk in more depth. We're going to go over initial enrollment, special enrollment, and then open enrollment. Next slide. Initial enrollment. If employees are receiving Social Security, they are automatically enrolled at the age of 65. And so that's something that's you need to kind of be in note of for yourself is, if you're already collecting Social Security before the age of 65, you're automatically enrolled. Employees in general, though, do have the 7 months period to enroll. You have the 3 months before the month of your 65th birthday, the month of your 65th birthday, and then the 3 months after your 65th birthday. That is your own personal initial enrollment period. It kind of goes around your 65th birthday month. If you don't enroll in Medicare Parts B and D when you are eligible, you may face financial penalties later when you do enroll, unless you have a special exception, which is existing coverage that's as good as Medicare. For example, your employee coverage or your spouse's employer plan are exempt from those penalties. We'll go to the next slide. We're going to talk about that in more detail, which is special enrollment. So in general, if you don't enroll in Medicare Part B and D when you turn 65 during your 7-month initial enrollment period, you may incur a penalty and/or gaps in coverage. However, there is an exception. You will not incur a penalty if you have coverage and it's an exempt reason and you're going to decide to sort of delay or enroll later. So if an employee does not enroll during initial enrollment for an exempt reason, you will be able to enroll in Medicare during what we call special enrollment. Employees who lose employer-based coverage have 8 months from losing coverage to enroll in Medicare without a penalty. For example, if you lose your employer-based coverage because you retired, for example, then you have 8 months from losing that coverage to enroll in Medicare and you won't face a penalty. After 8 months, you may face a penalty. Employees who missed initial enrollment for no exempt reason can enroll in general enrollment at the start of each calendar year. So it's not sort of the be all end all if you don't enroll when you're supposed to. There is a general enrollment period where you can enroll, but note you will most likely incur a penalty when enrolling during general enrollment. This is if you did not have an exempt reason. Next slide. Now, just to make things even more confusing, there's a third type of enrollment period or a fourth even, and this is called open enrollment. We are actually 2 days away from the end of this year's open enrollment period for Medicare. Annual period for open enrollment starts from October 15th and it goes through December 7th. If you have Medicare now and you're already enrolled, or your loved one who you might be navigating Medicare for is enrolled and you want to make some changes, you do have a couple days this year to think about and make those changes. December 7th is the last day. And that is the same period and the same dates every year, year to year, for those who already have Medicare and want to make changes. The open enrollment period is not for people who are initially enrolling, unless your birthday happens to fall within these dates and your initial enrollment period kind of overlaps, then yes. But the official sort of open enrollment period is not really for enrolling in the first time. It's for those who already have Medicare and who want to make changes. You can adjust your coverage annually during open enrollment. Like I said, you're not locked in to the plan that you chose when you first enrolled in Medicare. You have this ability to make these changes based on your lifestyle changes or, certain factors that are important to you. Employees who missed initial or special enrollment cannot enroll during open enrollment and must enroll during general enrollment, which happens January 1st through March 31st. Next slide. I see a question. What's the cost of the penalty? Here are your answers. There's different penalties for different parts of Medicare. And this is where you can play a crucial role as an employer in terms of helping prevent additional costs to your employees. You can help them avoid late Medicare enrollment penalties by reminding them the appropriate time to enroll if they have to enroll. For example, if they don't have that exempt reason, if they don't have existing employer coverage that would make them exempt, then they're not going to qualify for that special enrollment period. And if they don't enroll during initial enrollment period, they will incur a penalty when they enroll during general enrollment period. So listed here are the penalties for each part of Medicare. There are no late enrollment penalties associated with Part C because it is voluntary. I want to call your attention to Part B in particular, as this penalty is locked in for the remainder of someone's life. It's a 10% increase in the monthly premium for each 12-month period you could have had Medicare but did not sign up. So if it's multiple years of missing enrolling when you should have, and then you decide later to enroll, that's, let's say 3 years worth of not enrolling, that's a 10% increase for each of that. So that's a 30% increase in the monthly premium. And that penalty sticks with you for life as long as you have Part B coverage or as long as until you may become eligible for, some sort of financial assistance program. Part D has a penalty as well. You would multiply 1% of the national base beneficiary premium, which is an average for this year in 2023. It was on average $32.74. You'd multiply 1% times that, times the number of full uncovered months. So these aren't 12-month periods, but it's the number of individual months that you didn't have Part D or creditable coverage. Next slide. Okay, let's talk about Medicare and your business. If you are a business owner, thank you for joining and thank you for being willing to hear out how you may be able to help your employees without sort of needing to become Medicare experts, just knowing where to point people to and knowing when to remind them about certain deadlines. You don't need to be experts, and we certainly don't want you to advise, on how they make their Medicare decisions. It's really just about pointing them to the right resources and reminding them and knowing some basics. So one important thing to note is that employer size does determine Medicare requirements. How Medicare interacts with existing employer coverage is determined by employer size. For large employers, the work-based coverage is the primary payer, with Medicare providing secondary coverage. For small employers, which is fewer than 20 employees, it is the opposite. Some employees may not know how many employees work at your company. So be sure to indicate to your employees whether or not your business is classified as small. If you have an HR benefits person who's point of contact, it's important that your employees contact that person, that department, so that it's very clear they know whether or not which category they fall in. Since Medicare is the primary payer for small employers, employees at small employers must sign up for Medicare, or if they don't, they will have a gap in benefits. All this to say, what's primary, what's secondary. If you're in a small business with fewer than 20 employees, you must enroll in Medicare because the Medicare is your primary insurance. And even if you have employer-based coverage still after Medicare, that employer-based coverage is secondary and it won't pay anything unless Medicare pays first. So I think that's the most important point here. Again, large companies, different types of rules. And if you're more than 20, then there are some options. But in general, if you're continuing to work, the employer-based plan stays primary. And if they enroll in Medicare, Medicare becomes secondary. Next slide. There are a few common scenarios that most employees will choose. Since Medicare is the primary payer for small employers and failure to enroll may result in uncovered medical expenses, the vast majority of employees will enroll in Parts A and B during initial enrollment. This is for small employees, small business employees. For large employers, there are 3 scenarios that are most likely to occur. We have here scenario 1 where you enroll in Parts A and B during initial enrollment. Then that way you would have Medicare coverage along with your employer-based plan. In scenario 2, you enroll in Part A only during initial enrollment because in most cases, A is already paid. It's usually premium free, so it wouldn't be adding additional premiums. So most people have the option of enrolling in Part A during initial enrollment and delaying Part B, assuming this employee is still covered by an employer plan, until their special enrollment period. And then there's scenario 3, you can delay both Medicare Parts A and B until enrollment during the special enrollment period. But note that this is for large employers because the employer-based plan is primary, Medicare is secondary. You have this option to delay and enroll during special enrollment period, and then that would prevent you from having to be incurred a penalty. Obviously, there is a lot of variation, but these are the different sort of options. Of course, know your plan and know your scenario and your company in order to be crystal clear and make sure, that you're following sort of the right rules. Next slide. So here is a suggested initial enrollment education timeline. We talked about how you can play a role in helping your employees with their Medicare enrollment, and these are a few ways that you could do that. You can plan to send out, let's say, 4 communications to your employees in advance of their 65th birthday. The first communication should be a general primer about 6 months in advance of their birth month, just to get them started thinking about Medicare if they haven't already. Maybe they're not thinking about it at all. Maybe they're not aware that sort of 65 is that year where you're eligible to enroll. This is just sort of a good first start. In this letter, be sure to discuss the basics of Medicare, what they should expect during initial enrollment. And the basics of Medicare, you can certainly pull that information from trusted, reliable sources of information like Medicare.gov or AARPs.org/Medicare site. You can sort of take the language there to learn, to be able to educate about the basics of Medicare that we're learning today. As soon as their initial enrollment period opens, initial enrollment is that 7 month window that sort of on a rolling basis, dependent on that person's birthday, send the second communication with educational materials. This could include resources from third-party organizations. I noted AARP and Medicare.gov, but certainly there's a number of other resources that you could turn to. During their birthday month, be sure to share a list of unbiased sources of information and guidance. There are many brokers who spend a lot of time, trying to gain new business and trying to talk to new Medicare enrollees. Usually there's a lot of advertising that happens and marketing and paper mail ads as phone calls, usually unsolicited. So be watchful of things like fraud and scams, which sometimes do happen when it comes to Medicare enrollment. And, note that, the Social Security Administration or Medicare CMS would never call someone and, tell them they need to do X, Y, and Z or join this plan. All official communication would come via a written letter. But, it's kind of just be wary about the different types of communication and sort of bombarding that happens when someone's approaching Medicare eligibility. So you have to use caution when working with, I think, different brokers. During birthday month, be sure to share or people who you may not know are sort of licensed brokers and may not know where if they're providing trusted, reliable third-party information about Medicare. All right, looking at the education timeline some more. During the birthday month, the month that they turn 65, be sure to share a list of unbiased sources of information and guidance. Finally, a month before initial enrollment closes, reshare all the materials and one final letter, one final reminder letting them know you have a month left before you begin, before your initial enrollment period ends. And, if they are someone who has to enroll in Medicare in order to avoid a penalty, this is that time to do that. You have a responsibility, to help educate your employees on this transition. It can be an incredibly confusing, frustrating process, but I think with the right support, with the right resources to point people to, it can be more streamlined. Next slide. Okay, so we talked about all of those communication options and the timeline and suggested timeline when to do that. Here's just sort of a summary again, once more. We want clear and consistent communication to employees about Medicare and the transition, whether it's because they are turning 65 or they are retiring or changing jobs. Or losing coverage, you want to be able to provide that communication. You only refer employees to trusted sources of information, and we'll provide you sort of lists of those types of resources that you can consider to make sure that you're not pointing them in the right direction. And you want, before employees turn 65, you want to educate them about the Medicare program and what things to consider when they're sort of making their decisions. They should, maybe carve out time to be able to talk to them about Medicare. Next slide. Resources. So I mentioned a lot of resources that we will be able to point people to. Let's start with one main one, which is Medicare.gov. Next slide. If your employees have a specific question about their own Medicare benefits or plan, the place to go is Medicare.gov, or they can call Medicare directly at 1-800-633-4227. If they have questions about the choices of plans, they can also visit another resource that we'll be talking about, which is the SHIPS, and Maggie will tell you all about that. We'll share that website. But the Centers for Medicare and Medicaid Services, they have the Medicare.gov website, which is sort of one great starting point, especially when it comes to sort of your own plan. There's this option to log in, create your own login. You can compare plans, shop around, learn a lot of the basics. So this is one place to start. And it's the government website on Medicare. Next slide. All right, so now we have the SHIPS, as well as another nonprofit, the Medicare Rights Center. These are other options. Medicare Rights Center's website is available there at medicarerights.org. Their phone number is listed there. The SHIPS stands for the State Health Insurance Program. It's all about navigating Medicare. We have their website as shiphelp.org, phone number also listed here. And I will pass it over to Maggie, who will tell you much more about the wonderful SHIP resources.
Yes, thank you, Tricia. Excited to be here and loving all these questions that are coming in. Really appreciate the thought that you all are putting into the content being given today and to your employees. So before I dive into what the SHIPs are, I just wanted to give you a little bit of background on where they're located. So the Administration for Community Living is a division of the Department of Health and Human Services, and it manages the State Health Insurance Assistance Program, or SHIP. ACL was created around the fundamental principle that all people, regardless of age or disability, should be able to live independently and fully participate in their communities. We do this through a person-centered approach to services, offering a range of community-based services through a network of state and local partners. Our programs help older adults and people with disabilities find supports and services to successfully live in their communities. These include things like Medicare education and counseling, such as today's event, meals at home or in community centers, activities at senior centers, transportation, and a lot more. I'd encourage you to check out acl.gov to learn more about our work. Next slide, please. All right, so the State Health Insurance Assistance Program, or SHIP, is a community-based network of counselors who provide assistance in person and by phone, also virtually, as many of us have moved online. And they make group presentations and use a variety of media sources to educate folks about Medicare. It's a national program. It's offered in every state and in 4 territories. There are 54 SHIP grantees, all 50 states, Puerto Rico, Guam, the District of Columbia, and the U.S. Virgin Islands. The services are delivered by state units on aging or state departments of insurance in partnership often with their local area agencies on aging or other community-based partners. Nationally, there's a network of more than 2,200 local sites and 12,000 team members, including staff, in-kind professionals, and volunteers. In addition to the SHIP services, many of our grantees provide senior Medicare Patrol Program services. The S&P program helps Medicare beneficiaries protect, detect, and report healthcare fraud, errors, and abuse. So it's another great community resource. SHIP can help with a variety of issues, from helping people understand their Medicare coverage to helping them with their options, helping with enrollment, helping them enroll in low-income benefits as well to help cover the cost of their Medicare. Next slide, please. So to find your local SHIP, I encourage you to visit the SHIP TA Center website. It serves as a central source of information, expertise, and technical assistance for our grantees, but they also host the SHIP locator. So to find the SHIP in your community, visit shiphelp.org and select SHIP locator to navigate to your state, or you can call 1-877-839-2675. I would encourage you all to reach out if you want to provide Medicare education at your sites, or really want to help your employees as they're thinking about what their Medicare options are. The SHIP is a great resource. They'll be a little bit busy through the end of open enrollment, but that is coming soon on Thursday. So feel free to reach out as soon as you can. And next slide.
All right. Thank you so much, Maggie. Again, the ships are such a wonderful resource. Yes, it is a busy time for them. I personally have called the ships and have used them in my state to help navigate my parents' real specific situations. And so if you kind of find like you're needing more of that counseling, I don't think you should hesitate, and you should definitely reach out to them. I wanted to point you all to AARP's Medicare Made Easy information. It's all part of our Medicare Resource Center website. It's available at aarp.org/Medicare. We really try to help you understand Medicare, and the consumer understand Medicare in an easy, digestible way, because we know it can be sort of overwhelming at first. And it's a lot to remember. And, even me, I need to ask and constantly look up and remind myself the information about Medicare. Next slide. One really helpful tool is especially when you're enrolling for the first time, is AARP's Medicare Enrollment Guide. It is a step-by-step guide, and you're inputting information about your or the individual that you're helping, their situation, so that this can help you make an informed decision about your Medicare coverage. This is available at aarp.org/learnmedicare. And it is, like I mentioned, a step-by-step. You're not putting in personally identifying information or anything like that. You're just sort of indicating if you're 65 and still working, or if you're, interested in certain things. You kind of choose your own adventure per se as you're clicking along, and then we'll narrow in and give you sort of more customized information about your situation. And this has been sort of tested with lots of consumers, and I think we've really figured out a way to make this digestible and easy for you to use and share. aarp.org/learnmedicare. You do not have to be a member in order to be able to use our resources on Medicare, or our enrollment guide here. This is all part of AARP's social mission side of things. So you can certainly share this with your employees and use it yourself, and there's no cost. Next slide. Another great resource that we have are recorded and live consumer webinars on Medicare. You can point people to aarp.org/Medicare employer, and we have a number of sort of recorded webinars that we've done throughout the year. Some of them are going to be on deeper dive topics on Medicare. Some are going to be more timely things like new changes to Medicare. Others are going to be, some basics to know, things like around open enrollment. In any case, look at the topics we have here. You just register. Another free experience that you can use for yourself or for others. You can share. Visit aarp.org/Medicare employer. Next slide. So in conclusion, I know it was a lot of content today and a lot of talking, and I really appreciate the interactivity and chat we saw, as well as your time and focus today. I hope it was helpful to you. If you wouldn't mind, while we're sort of wrapping up and looking at the questions that have come through, could you answer these 3 simple questions for us? Let us know if the information was helpful. Do you feel more prepared to talk to your employees about Medicare? Do you think the information that we shared today will help your employees make informed decisions around Medicare? Thank you. We covered Medicare basics today. We covered educating your employees on Medicare, and we covered resources and tools, including the wonderful SHIP program that's offered by ACL. Let's go to the next slide. I think then we are off to a couple questions. Colin, what do we have? I think I've seen a few in both chat and Q&A, and we can try to go through them.
congrats to you and Maggie for providing such amazing information. I know, as you mentioned, there's so many different pieces. And so we're just getting to the questions now, but I want to quickly start, Tricia, with just a kind of reiteration of, as a small business owner with Medicare, what is your kind of legal responsibility as it relates to helping your employees with Medicare? So I think there's a few questions about that. We want to make sure we're crystal clear about that.
I mean, I don't think any of these are necessarily requirements for employers to do or regulations necessary that you have to do these things. This is sort of nice to do. I think if you really want your employees to be able to avoid any penalties, to feel like they can sort of weed through the resources that are out there, if you can kind of point them to the ones that we have outlined today that show that are the unbiased sort of government nonprofit resources that we think are most credible. So again, no, the penalties that we talked about, that is not penalties on the small business or the company. Those are related to the individual who doesn't sign up at the right time. So this is more just sort of things that you can do from the educational side.
No, really, really helpful. And again, this is a step that business owners can take, because a lot of times we know that you guys get questions from your employees about a whole range of topics. And so we wanted to make sure that there was an opportunity to get educated and some best practices relating to that. We only have a few minutes left, so I do want to quickly move through a few questions. Samuel asked, can a self-employed owner of an LLC have Medicare coverage for themselves through the company rather than separate from the company? Is there any advantage to it?
I'm going to defer to Maggie to see if you know the answer to that question.
I do not, but I will say the ships would know the answer to that question. They are really well versed in the ins and outs and all of the specifics for each case by case. So I'd encourage you to reach out to your local ship.
Yep, and again, the ship finder is the best way to find it in your state. And you can find that at the link that we mentioned. We'll also, I know we're seeing a few questions about the recording and the slides and all the resources. Everything that we've mentioned today, we'll share via the email that you registered with. So the recording, all the resources, the links to the ship, so that you can take a look at it and hopefully pass along this information to your employees who may be interested in doing that. Great. And then just one more question here. I think we have time for, if I have group health insurance through my work and a supplemental coverage for my husband's job, do I still need to enroll in Part A to avoid a penalty?
I would say in general, no, you would not have to. However, it depends. Call the ship just to make sure, but I think it depends on your employer size. If you have spousal coverage, I think you should be covered. But again, triple make sure. And your question was specific to the Part A penalty, which I have to kind of go back to, but that's most people typically have premium-free Part A. So that's one thing to consider, whether you want to delay that or not.
Awesome. Well, I know we're at time, and so I want to be mindful because we just had such a jam-packed presentation today. So again, we'll send out the recording and the slides and all the resources afterwards. But thank you all for joining and for listening in, and thank you, Tricia, and thank you, Maggie, for all the great information and resources. Tricia, Maggie, any kind of final comments or thoughts?
Just a thank you. Thank you for your time today, for taking a moment to learn Medicare. I know it may not always be something that's top of mind for everyone every day, but just something we wanted to point out, that there are these sort of impacts if you don't enroll at the right time, and we wanted you to help be a voice in sort of spreading the education and information about Medicare. So really appreciate it. Remember, if you already are a Medicare enrollee, there are 2 days left in the open enrollment period. It ends on December 7th. Maggie?
I think you said it all. Thank you all. I appreciate you taking the time to join us today.
Thanks, everyone. Hope you have a great holiday season.
All right. Well, now this is the official end of the webinar. Have a great holiday, everybody. Bye now.